Another fact in question proponents for fluoride argue is that putting fluoride in our drinking water is helping the rates of tooth decay decline. However, there is little or no evidence to support this. In fact, there is evidence to the contrary. In a large study done by the National Institute of Dental Research in the United States Public Health Service, examined 39,207 U.S. school children from 84 different geographical regions, aged 5 to 7. The $3 million study concluded that there is no relation between tooth decay and fluoridation. According to Null, ironically, the lowest tooth decay rate occurred in a non-fluoridated region. The study clearly shows that fluoride has no impact on improving dental quality in the children in the U.S. We need to take a closer look at the research being done. Most of the studies done on the benefits of fluoride were done before 1975, and the tests were flawed and research is inconclusive. Though the evidence supporting the harmful effects of fluoride is overwhelming, there is a huge ethical dilemma regarding the substance in our public drinking water supply. The FDA calls fluoride a drug. We are being medicated without our consent. In fact, Conant goes on to state, informed consent is standard practice for all medication, and one of the key reasons why most of the Western Europe has ruled against fluoridation, which is forcing people to take medication irrespective of their consent, what doctors cannot do to our patients. We are being medicated without permission, and a lot of times we don't even know it. The problem is also that medication is supposed to be taken at different doses depending on the individual. An infant shouldn't be taking the same dose as an 180-pound man. Equally as unsettling as the fact that we are being medicated without our consent is that there is no way to control the dosage of intake of fluoride once it's released into the water supply. Athletes, according to Null, and people living in hot climates are exposing themselves to higher fluoride rates. They naturally consume more water. In fact, there's a disease called fluoridosis, which is an overexposure to fluoride, which causes deposits to be left on the teeth. This is not the only place that fluoride accumulates in the body. It calcifies the bone and the pineal gland, a gland located in the center of the brain, responsible for the synthesis and secretion of hormone melatonin. Melatonin maintains the body's circadian rhythm, sleep-wake cycle, regulates the onset of puberty in females, and helps protect the body from cell damage caused by free radicals. This is according to fluoridalert.org. It is estimated that around 40% of the teenagers have signs of fluoridosis. According to Mercola, it is likely that this is a sign that children are receiving higher amounts of fluoride from multiple sources, including not only drinking water but also fluoride toothpaste, beverages, foods, pesticides, tea, nonstick pans, fluorinated drugs. Even if a certain amount of fluoride was demonstrated to be effective, at treating cavities, with the prevalence of the chemical in our everyday food and drink products, it is safe to assume collectively we are ingesting more than that amount. Advocates of the fluoridated drinking water would argue the benefits of oral health, preventing tooth decay, but however, benefits of fluoride have demonstrated to be equally effective topically, not systemically. It has become clear, according to Maine, that in the last 15 years, the fluoride primarily acts topically. This is also according to the CDC. Maine also states it reacts with the surface of the tooth enamel, making it more resistant to acids excreted by bacteria. There's no good reason to swallow fluoride and subject every tissue to your body. Maine also states studies that attest the effectiveness of fluoridation were generally done before widespread usage of fluoride-containing dental products like rinses and toothpastes in the 1970s and later. So while it may have been useful to add fluoride to the water, it no longer appears to be necessary as it once was. Another study by Maine as stated by Maine, tracked the fluoride consumption of more than 600 school children in Iowa, showed that there was no significant link between fluoride ingestion and tooth decay. What seems to be a rather outdated practice needs to be reconsidered, given the new evidence showing the detrimental effects on the mental and physical health. Based on my findings, I believe the U.S. should stop fluoridation of the public drinking water supply. The information found in the studies is alarmingly alarming and unsettling to know that we are ingesting such a harmful, toxic substance on a daily basis. There have been countless studies showing the negative effects on human health, including infertility, decreased IQ, and birth defects. Not to mention the fact that there's no evidence to support fluoride when systemically ingested has any oral benefit to the public. Fluoride is a drug according to the CDC, and we should not, as part of our legal rights, be forced to ingest any medication against our will. This is a standard patient-doctor practice. Why is it not being practiced on a larger scale? This outdated practice needs to be brought to the attention of the public, and we need to convince our local office the importance of the issue so we can reevaluate it with all the facts on the table. We need to reevaluate the practice against the potential threats to human health and be able to make informed decisions to keep it out of our water supply. This is our right.